This is the second in a series of short instructional video in which I want to show you what is really important with your physical therapy if you're not able to get into your physical therapist or see us in the clinic over the next couple of months with COVID-19. This next series will be on the knee. For the knee, I'm really looking at two things on your first post-operative visit. I'm looking at terminal extension, how straight you can get your knee, as well as the kneecap mobility. Let's get both of those through two different techniques. For terminal extension, two options. A towel is helpful. You can roll it and put it underneath your ankle, push down on your thigh, on your quadriceps, and feel the stretch as you push it out straight. Another option, which I prefer, is the towel around to pull up and stretch your calf. Prefer you don't activate your muscle for just the stretches. Take the thigh and push down as you pull back on the towel. And that's a nice way to help accentuate that terminal extension. Kneecap mobilization is also very important so that your kneecap doesn't scar down to the neighboring tissues and limit motion and ability to strengthen your muscles. To do so, it's very simple. Let the leg get nice and relaxed. Take your kneecap, manually push medial and lateral or side to side about 20 times, and superior inferior or up and down about 20 times. And you can do 3 sets of that. Immediately post-op, you'll see 3 different exercises that we want you to do. The first is straight leg raises. Lift the leg. I like to count to about 5 seconds and then down. That will fire your quadriceps, and you can do 10 sets of that. Second is heel slides. Back and forth with your heel on the floor to the motion that's comfortable for you. And the third is ankle pumps. 30 repetitions. Once I've cleared you to advance your strengthening, it's all about stationary bike. If you don't have access to a stationary bike at this time, due to many of the gym closures, there's a couple of things we can still do. Although squats and lunges are excellent physical therapy exercises, if you're not under the guidance of a physical therapist, there can be a lot of injury that can occur with improper technique. This is a pretty foolproof way to get your quadriceps strengthened if you don't have access to a stationary bike. Wall sits. Place and hold for about 30 seconds, and then rest and repeat to 3 sets. As you get stronger, you can get all the way down to the maximum of right angle to 30 seconds. And then you can increase the time as you're able to. For hamstring activation, taking a towel around the foot so the calf is on stretch. Activate your contralateral, the non-injured quad, so you make a tight thigh on the left side, and that'll keep your pelvis from rotating around. Then locks that in. Knee out straight and provide resistance. Place and hold for about 30 seconds, and then relax. And you can do 3 sets of that. Again, there's no substitute to good physical therapy, but if you can't get to the therapist in this time of COVID-19, these simple stretches and strengthening exercises will be all that you need, and they're very safe until you're able to see us back in clinic and get back into your physical therapy. Patella mobilizations and knees terminal extension. I don't worry as much about the flexion. We can get that later if need be. Immediately post-op, we talked about the heel slides, the ankle pumps, and the straight leg raises. And strengthening with the quadriceps, with the wall sits, and the supine hamstring activations with the towel.